Hello, everyone, and welcome to today's session. My name is Crystal Fullerton, and I am the Farm Safety Coordinator with the PEI Federation of Agriculture. Together with a grant from the PEI Workers' Compensation Board, we are proud to present to you our Building a Sustainable Farmer webinar series. I'd like to introduce today's presenter, Shawn Foubert, registered massage therapist who has been practicing and teaching since 1988. Shawn specializes in a full body approach, including the mind, body, and spirit. He looks at a patient's medical history, work habits, family dynamics, and exercise routine to create the best care package for that individual. Shawn is sure to provide an interesting and informative talk about the value of massage for agricultural workers. A few housekeeping issues to introduce before we begin. Please mute during the duration of the webinar to ensure a higher quality sound for everyone. We do have a chat and Q&A section. Please pay attention as there are boxes that you can check off to ask your questions anonymously. We encourage all dialogue because we want you to get as much as possible out of these webinars. Sometimes being anonymous will help questions pop up that others were too shy to ask. Shawn does not mind if you ask questions during the webinar, so please ask away, as this session is about learning about the importance of massage therapy to the farmer. Also, there will be a poll during this webinar, and we do ask that you participate. It only takes a minute, and it's very simple, yes or no multiple choice questions, and it helps us and our funders determine if we're moving in the correct direction with these webinars. If you have any additional questions after the event or suggestions for other speakers, you can contact us at farmsafety@peifa.ca. We will be providing a recorded version of this webinar at a later date, so please check our website and YouTube channel. We would love for you to share this information. For those of you just joining us now, welcome. And now I'm going to pass over the webinar to Shawn Foubert. Enjoy.
Hi everyone, how are you? As Heather said, my name is Shawn Foubert. I've been practicing massage therapist for 32 years. I'm here to talk to you today about how massage therapy can help in building a sustainable farmer. There is one correction on the webinar I'd like to make. I do not work for the Canadian College of Massage and Hydrotherapy. I am part of the staff, but since COVID, I have been off work teaching there because we have reduced capacity. But I am a practicing massage therapist, and I do teach courses outside of the school. All right, let's start. I'm going to go through a small slideshow for you. Building a Sustainable Farmer, Massage Therapy and the Farmer, and the Benefits of Self-Care. Assets for the farmer. When we talk about assets, let's start by defining what is an asset. It's a useful or valuable thing, object, person, or quality. So it's not necessarily just a building or a tractor or a piece of land. It can be an object or a person as well. Assets are the people involved in the farm. They're the farmers, family, employers, employees. However, they are also people from stores, supply chains, and transportation. The farmer has many different faces. I'm just going to show you a few different farmers from around the Maritimes. Next, we have families. Same with families. They don't all look the same. So in farming families, some consist of a father, mother, and a bunch of daughters. They're great, but when they're this young, they don't get to help out in the farm too much. Then we have other families, where they're brothers and sisters living together with their wives and spouses, and they're all older and they can all work, which helps make the farm run a little easier, I'm assuming. And then there's other farm families where you have husbands, wives, some older children, and some very small children who really can't help that much. The employees come in many shapes and sizes. Some are full-time employees, some are part-time employees, some people just come in to help reap the crops. Some pictures of them. These are all pictures from around the Maritimes. And sometimes we just have equipment that does it too, with farmers, people driving them. These assets also include the land or the farm, in which may be a small farm family of several acres, or up to large farms that could include sections of land. I've lived all across the country, and I know it's not unusual to see a 4-section farm in Alberta. Whereas where I'm from in Southern Ontario, when I was a young child, I worked on a 75-acre dairy farm. So they are very big and small, and they all produce. The product, the land comes in various shapes and sizes. Again, these are all pictures from the Maritimes. And that's a pretty one, right from Prince Edward Island itself. The product that you produce. What is the product that you produce? We have producers that produce vegetables, fruits, grains, dairy, which includes cheese and other products from the dairy, egg producers. We have a number of meat producers across the provinces, producing everything from wild game up to pork, beef, chicken, lamb, etc. All these producers have different needs to run their businesses, but the one thing they do need is healthy people to run them. So we have some other pictures of things from around the Maritimes. I don't know. Cows just look so pretty, don't they? And then, of course, that is a beautiful shot. The equipment. The equipment, which can encompass a whole swath of devices, from hand tools to large tractors, combine units, and to the family vehicle. Part of the equipment may be the people that runs these pieces of equipment. We have tractors, and so forth. Now, the first part of this was, these are assets. What is your most important asset? Out of all those assets that we showed you, did you come up with an answer? So you were overworked. I'm going to go back a minute. Sorry, my mistake. Out of all those assets, what is the one that you answered? Was it the farmer? Was it the tractors, the land, the farm, the produce, the product, the family? If you answered this question, I want to say there's only actually one right answer. First of all, I want to start by saying farmers are the hardest working people in Canada. I worked on a farm for many years as a youth. I haven't been on a farm in over 40-something years, which shows my age, but I know how hard working on a farm can be. And I want to thank you all very much for what you do. If you answered to any of these, other than the fact that the farmer was the number one answer, I will have to tell you that you've been incorrect. There's always a number one and a number two. And we have been taught that to think of ourselves as number one is selfish. And this way of thinking is old and antiquated. And it's just plain wrong. Think of this for a second. Indulge me. If you don't take care of yourself first, and something happens to you, who will be left to take care of everything else that needs taken care of? You have to think of yourself as number one so that you will always be around to take care of the number twos, threes, fours, fives, etc. The farmer is the most essential piece of equipment on the farm. All right. So we're going to go on now. We have the land, the farm, the product, the products, the crop. We've gone through all this. Questions. Are you overworked? I'm assuming you all have an answer for that one. Does sometimes life look a little hectic? Hours. Are there just too darn many in a day? Or are there not enough in the day to get everything done? What can you do? What can you do? As I said earlier, farmers are the hardest working people in Canada. I'm not just saying that, that's something I truly believe. And you can't do it all yourself. Now, I'm not an expert in this. I've had some help from some friends of mine and some farmers around Nova Scotia, talking to them on the phone about what can be done. So millions and millions of questions. I don't have that many answers. The answer to the question 1 and 2 is yes, of course. You are the hardest working people. And you are extremely busy. And there's never enough hours in a day. However, you cannot do it all yourself. Solutions, some of the solutions people gave me were to delegate work to others. Sounds pretty simple, but there's not always others to delegate it to, so we try our hardest. We can ask for help. And there's seasonal help available. Some people said there are programs through certain government agencies that you can contact as well, but I don't know enough about them to speak about them. One gentleman said that he had friends, and he calls his friends when he's very, very busy, especially during harvest time, just so that they can come out and maybe drive a piece of equipment for an hour or 2 hours a night, just to help out. So he depends on not only his family and his friends, but the community to help out as much as they can. Your body, maintenance of your most important piece of equipment on the farm. Any ideas what your most important piece of equipment is? I think we already led to it. Your body. Your body is the most important piece of equipment. I know it's hard to think of it that way, but it is the most important piece of equipment. Maintenance is why people have told me, is what people have told me doctors are for. This is incorrect. Doctors will help you with maintenance, but you're responsible for your body. If a piece of equipment on a farm needs maintenance, like say an oil change on a piece of equipment, do you put it off indefinitely, or is it prioritized? I think we all know the answer to that one too. And I'm here to say it's time to make you the priority. You need maintenance to ensure that you are healthy for everyone that depends on you. Massage can help repair your body, whether that be from an injury. Sorry, some funny little slides. I hope you like them. The real slides on injury are not very nice to look at. They can be chronic. One of the common ones is chronic back pain. Those injuries can be acute which is nothing cute about acute. Acute just means that you're actually walking around with a cast on or a visible cut, a scar, something that needs immediate medical attention. Broken bones go in there too. Pain. Pain can be caused by a number of different things. And pain can come in many different forms. And luckily, this poor fellow's having pain in his right shoulder and not his left, because his left would mean he might be having a heart attack. So we don't want that to happen. Neurological pain is one of the things that can happen. Neurological pain basically means that pain that you may feel in your leg may not be coming from your leg, but from an impingement of a nerve that flows down your leg, as in sciatica, or as we come across a lot of it in massage therapy, is sciatic syndrome. The sciatic nerve is formed between the bottom 3 or 4 vertebrae of your spine. All the nerves come out and they form one very large nerve that runs through your buttocks. There's a very small muscle in buttocks called piriformis. It's an external hip rotator. And if it gets tight, the sciatic nerve runs directly underneath it. And it puts pressure on the nerve and causes sciatic-like pain, which is sharp, shooting pain, which is sometimes unbearable and makes you sit down to the back of the knee or to the front of the leg. True sciatic pain will run all the way down to the foot. And true sciatic pain is something that's done. That's what we call a structural issue rather than a soft tissue issue. So structural means something to do with the spine. Neurological pain can also come from things like a stroke. I myself have had a stroke 3 years ago, and I have recovered very nicely, but I still experience sharp shooting pain in my right foot for no reason whatsoever. And it doesn't happen all the time, but when it does happen, I know that there's nothing wrong with the foot. It's just my brain telling me there's something wrong with the foot. So neurological can be tricky sometimes. Fascia pain or fascial pain. What is fascia? All the white areas you see are fascia. I refer to people when I try to explain to people what fascia is. I tell them if they've ever seen a rack of pork ribs and it has that white, what we call silver skin on it. Well, that silver skin is fascia. And as you can see by looking at the human body, we have fascia as well. We have lots of fascia at the back of our neck. The entire top of our head is fascia, especially around our ankles, our knees, our lower back, our hips are full of it. Every item in the body, every organ in the body, every muscle fiber, every nerve fiber is covered by fascia. And fascia is one piece from top of the head to the bottom of the foot. There is no definition. I can't say, let's take this nerve piece of fascia out of the neck and replace it with a good piece, because there is no stop and there is no go. The neck part joins into the head part, joins into the back part. It's like that old song we used to have, the knee bones are connected to the hip bone, all that other fun stuff. It's all connected. Fascia can be injured by surgery. And when you have surgery, then you have fascial scarring. Scarring can help limit range of motion. Fascia stretches like a rubber band. And if that rubber band is injured, it doesn't stretch very well. It actually forms like a bunch of pickup sticks. So there's no stretching whatsoever. It's just a tight knot. And sometimes we get fascia build up in our muscles that causes what laymen call knots. What myself as a massage therapist and my colleagues call a trigger point. So if you hear us referring to a trigger point, it's basically a knot in a muscle. Muscular pain can come in many different forms as well. So as you can see, another shot of the muscles. And no, we don't all look like this. I wish we all looked like this, but I don't. Muscles can be, if you pick up something that's too heavy for you, if you move the wrong way, if you're playing sports, if you're in an automobile accident, there's many, many different ways. When people fall, they can actually tear a muscle. They can And a tear can be 1, 2, or 3, or 4 grade. So you can have people have a partial tear, which will usually is someone who works out. If you work out with weights every day, you're physically tearing your muscles up, and then they're rehealing, which is why they tell you not to exercise every day, to take a break in between, to give your muscles that chance to reheal. And more severe tears, if you can trip and fall, and your ankle goes a funny way, your leg goes one way and your body goes another way, and you could tear a muscle in your hamstring or in your quads. And those tears may take, usually blood supply to the muscle is very good. And a tear like that, grade 2, will heal in about a week. Usually doesn't take too long. If you have a grade 3 tear, again, it's a more serious tear. More of the muscle fibers have been torn. These are muscle fibers where they'll tell you to stay off it for a while, and you won't be able to walk if it's in your leg. You'll be walking with a limp, a very severe limp. And these would take anywhere between 3 to 4 weeks to heal. Depending on how young you are, it could take longer as we get older. And the last tear is a complete tear. So you've heard of people who maybe have torn their Achilles tendon. Well, when they tore their Achilles tendon, the muscles in the bottom leg roll up like a Venetian blind in the bottom of the leg. And that is a very severe injury and has to be fixed by surgical intervention. I know muscle can help many different types of pain. However, it is after using massage to help repair your body from injury. If you continue to use it as little as once a month, which is what we suggest, this is maintenance. Maintenance will help prevent your injury from reoccurring, or will help prevent an injury from occurring at all, and to help with you with postural correction. We've all heard it. Good posture is what we need. Do most of us have it? We don't think so. Strange picture. There are many people suffering from one thing or another under the umbrella of, so let's say, unearthing the stigma of mental health. In today's society, this statement doesn't have that stigma that it did when some of us were much younger. Disease, illnesses seen as a burden to carry to most who have them. Don't keep it buried. Do like your dog. Dig it up. Let people see it. Share. Help is available. There are many different forms of help. Massage therapy is a very useful technique. There are doctors who specialize in mental care. There are psychologists. If you're a religious person, there's your local priest. There's help in the in the medical field as well. It is building and it is getting stronger and stronger. It hasn't been the best in some provinces, but it is building up, and they are getting more and more help out there. You can always talk to your friend, but definitely let people know. Don't keep it a secret any longer. It's time to get it out there. Some of the mental orders that we could fall under that umbrella. There are many different issues again, and these are just some of the issues under that umbrella. Anxiety. So anxiety, I don't know if you can all read that. I think I can. Anxiety feels like wearing a corset. Your chest is too tight, it's hard to breathe, and your stomach hurts. You're uncomfortable, and in your own skin, you seem stiff and awkward. Now, I've never worn a corset, but I'm assuming that's what it feels like. The one I like is being on stage all the time, and you don't know it's your line, what your lines are. It's anxiety. It makes you feel uncomfortable. If anybody suffers from it, it's not as easy as it sounds. We see a lot of people in our field for this disorder. Stress and its effects. Stress. stress, it says on the picture it's a big one, and it is. In the 1950s, Dr. Hans Seal described stress as a non-specific response to the body and any demands put upon it. Stress can cause blood pressure to rise. It can cause muscle tonicity to rise, which is tightness to rise in the muscles. It can make your hormone levels go all out of whack, and it can make you worry. The word worry is one of the words that I like to describe all the time. People hold on to worry, and they worry about things that they really have no control about. Worry comes from an old English word called rigam, which originally meant to strangle. But the biggest one I like is when you use it in referral to a dog. As in, a dog worries a bone. If a dog worries a bone, he gnaws it and he chews it until there's nothing left. And this is what worry does to the inside of your body when you hold it in your body. So we have to have a way to get rid of stress and release it. That's what I'll be getting to. Depression. Yeah. Gloomy Gus, always walking around with a cloud over his head. Depression is a hard one. Sometimes it's hard to get motivated. Sometimes it's hard to get off the couch. But depression can also be a chemical depression. So just because someone's feeling out of sorts, you can't just say, come on, let's put a smile on and get over it. Sometimes they have a chemical reason in their body why they are depressed, and medical attention will help. Massage also helps in these as well. Bipolar disorder. Pretty much says it right out front, although the bipolar bear is kind of interesting. But yes, one minute you feel, ooh, great, fantastic. And the next minute, it's essentially you're bleak and you're down the dumps and you don't know what to do. So bipolar can switch on a dime. People with bipolar, there's many, many medications out there that can help. You would have to see a doctor or a psychologist to get them. And some people don't like the medications what bipolar does to them. But sometimes it takes a while to play with the drugs with the doctor and figure out what's best for you. Massage can also help with bipolar. I'll go into explain a lot of this later. Post-traumatic stress disorder. The truth in that slide is right there. He never talks about it. So someone has gone through a post-traumatic stressful thing in their life. I got a picture off the website where Crystal works. And I didn't want to put it on here, but it was about a man's clothing that was wrapped around it looked like an axle. I know there's a PTO drive, I think it's called. I'm not a farmer, so excuse me. I think that's what it's called. And just the clothing wrapped around it. It didn't show the man. And I'm just thinking, someone who's gone through that and doesn't let it go, they're suffering from PTSD. It doesn't have to be from an army. It doesn't have to be from being in a war. PTSD can be something that happens to you in everyday life. And it is treatable. But you have to let people know that it exists. Autoimmune disorders. Autoimmune disorders. This is exactly what it's like. The body yells, wait. And parts of the body is saying, no, attack me, attack me. And the body cells are saying, but I'm one of you. And they're saying, liar, and they attack you anyway. So it's when your body turns against itself. Some of these disorders are things like alopecia, which somebody might have heard about. Women are pregnant, they'll lose patches of hair. Sometimes people lose the hair all over their body for no reason whatsoever. They don't know what causes it. Crohn's disease, IBS, irritable bowel disease, or irritable bowel syndrome, lupus, rheumatoid arthritis, tinnitus, fibromyalgia, chronic fatigue syndrome, MS. These are just some, to name a few of these disorders out there that we call idiopathic. Idiopathic means there's no reason for them. Nobody explained why people get them. But there are a lot of theories. Meaning the medical, basically, idiopathic basically means the medical community and even medical community that I'm in, we really don't know. We haven't a clue. I've listed them all because in autoimmune here as some of these umbrella mental disorders. It's not a mental disorder in a sense, but if someone has suffering from fibromyalgia and they don't know what they're suffering from, and they're always sore and they're always complaining, and they have no scars, they have no broken bones, they can walk, they're just sore. They had explain it to them. Their family thinks it's all in their head. Finally, they get a name put onto the disease, and all that anxiety about being in their head goes away. Now they have something. Now they have a disorder, they feel better. But also the diseases I listed off, or the disorders I listed off, the number one cause for all these disorders is stress. So moving on, getting close, guys. Massage has been very successful in conjunction with medical treatment to treat a variety of forms of mental health issues with great success. You're sick and tired, or both. What can be done? What can be done? Are you getting sick a lot? Feel like this sometimes? Massage can increase blood flow, which increases good stuff going into our body, oxygen to our organs, and the right hormones to our organs, et cetera, et cetera. It also increases the garbage takeout, so it increases lymph drainage and so on and so forth. It can lower blood pressure. It can boost your immune system, and it can decrease pain by releasing serotonin into the body. Are you tired all the time? Do you ever fall asleep standing up? Tired, massage can boost your energy. Some companies in Canada, I used to work for one in Ontario when I was there, they would ask me to go in and do 20-minute chair massages on their employees at lunchtime. Because at lunchtime, the employees' work ethic would go down. They wouldn't get as much done. By doing a 20-minute chair massage, when they went back after lunch, their actual productivity went twice as high as it was in the morning. So they actually got more work done the days that they got massages done. Not sleeping well? We can help with that. Most people tell me when they leave their room is, I'll sleep good tonight, and they will. Massage just helps you relax. It just helps you rest. It helps you get out of your own mind, even if it's only for an hour, or 90 minutes, or 2 hours, depending on who you go see and how long the massage is. It just allows your brain to disconnect and your body to go and breathe. Sometimes we just need to breathe. Restless legs. Guy's legs are a little jittery there. It's not from the coffee. Restless legs can keep people awake at night as well. Mostly women suffer from restless leg syndrome. Not very often is it a man, but sometimes they do. The reason why is they don't really know if there's a reason for restless leg syndrome, except for one, and that is that a low iron or iron deficiency can cause restless leg syndrome. So many women after their monthly cycle will experience low iron, and they'll get restless leg syndrome for about a week, and then it'll go away. And that's just your body rebuilding its iron levels again. If you're having this on a constant ongoing basis, see your doctor. Irritable? Looks irritable. Irritability. Massage can help calm the mind. It helps calm the body. It helps you relax and take your mind off business. It helps you get centered and balanced. Are you forgetful, forgetfulness? I know I am. Sometimes forgetfulness and can be caused by an underlying problem. A lot of the time it's fatigue. A lot of times because you're tired, you're cranky, you're irritable, you're not sleeping well. All of these things, maybe you're feeling a little bit under the weather. All these things can contribute to forgetfulness. It's not always that you have a problem like Alzheimer's or dementia. Okay. Deepak Chopra once said, if you're holding your keys in your hand, or you're looking for your car keys and you can't find them, that means you're forgetful. If you're holding the keys for your car in your hand and you don't know what they are, chances are you have Alzheimer's. So sometimes just being forgetful, it doesn't mean that we're getting old. It doesn't mean that we're getting senile. It just means that our body needs to recoup. We're getting tired. We're getting sore. And it's time for us to get into a little bit more educated on how to take care of ourselves or how to keep ourselves healthy. Are there any questions from anybody in the group?
I'm going to pop in here for a minute, Shawn. I'm going to launch the poll and give you a chance to have a drink of water or so before I ask a few questions of you.
Mm-hmm.
So the massage therapy is, you mentioned it being able to lower blood pressure.
Yes.
So in order to do that, does it have to be like a full body massage, or do you, like acupuncture, you target certain areas?
No. The reason why when you go in for a massage therapist or go in for a massage, if anybody's ever been to a massage and they ask you to remove your clothing and you say, well, I'm having my back massage, why do I need my pants off? The reason why we need your pants off is because if the pants are tight, just by massaging your back, we're increasing blood flow throughout the entire body, not just your back, not just the areas we are touching, but the entire body. So by having the tight fitting clothing off from around your tight socks, tight belt, whatever, it helps increase the blood flow throughout your whole body. So everybody who gets a massage has lower blood pressure by the end of the massage, which is why we tell people when you sit up, if you feel a little lightheaded, it's just your blood pressure stabilizing, because it has lowered while you were laying there getting relaxed. The longer the massage, the longer the relaxation, depending on what kind of where the body is and what you're getting done. Most people will not do a painful massage or a massage that causes pain for more than, say, the first 20 minutes. And then they'll work their way back out so that it limits bruising and stuff like that, if there's any bruising that might occur. We have to go in slowly and come out slowly, basically into the muscle slowly, come out of the muscle slowly. And we have to keep that blood flowing all the time to reduce anybody being over sore the next day or for bruising.
Oh, so is that common that individuals could feel almost more sore after having a massage?
They should feel like they've gone to the gym and worked out. But they shouldn't limit them from going to work. With that being said, it should not limit them from going to work. You have to remember, if the person's working on your body, you got to remember one thing for me when you go in for a massage. Nobody knows your body better than you do. So if they're hurting you, you tell them to bloody well stop. Because massage doesn't have to be extremely painful. It may be a little sore, like you worked out of the gym. But if they're causing you pain, they're not helping you any. I've been doing this for a long time, and I don't see how causing someone more pain when they come in to see me than when they came in to see me in the first place is efficient. I don't see how that works. It didn't take people usually an hour to get into this situation where they need my help. And it's not usually going to take one treatment or an hour to get them out of the situation. Although they are going to feel much better after that hour. The effect of massage lasts sometimes for hours, sometimes days, sometimes weeks, and months. And that's why we suggest when people are finally at a point where they are balanced and healthy, a 1 hour massage once a month is maintenance. It keeps your body to that point where you won't injure yourself by being too tired by trying to step over a piece of farm machinery that maybe you should go around, by trying to lift something and not thinking properly about how to lift it, bending over and picking up something, even if it's just a pen off the ground. You can throw your back out because you're not just lifting the pen off the ground, you're lifting your entire upper body as well.
So you bring up a good statement there. Throw your back out.
Yeah.
So
Don't do that. You get one.
I would assume you get a lot of people coming in with back issues, and that would be a big one for the farming community, especially.
I get a lot of people with back issues, and one of the biggest ones I get from farmers is when I see them walk in is tell them to take that wallet out of their back pocket and put it in their bloody front pocket. You wouldn't walk up to a comfortable chair around your dining room and put a 2x4 under one side of your butt to sit down. Why are you doing it with a wallet? You're throwing your hips out of balance. That's one of the biggest things I see. Women wearing purses. I understand we have a lot of things that got to go in our purses. Some of them are heavy. Wear them across your body. Don't wear them on one shoulder, please.
So you're seeing our lifestyles are affecting our bodies in a way that you're trying to help with massage.
Definitely. I've lived in some pretty big cities in my life, and never in any of the big cities have I seen men walking around with their wallets in their back pocket.
That's more because they're hoping nobody will steal them.
They're hoping nobody will steal it. That's right. That is correct. However, it's also healthier for them because it's not sitting, and they're not sitting, putting pressure on those muscles in your butt that are causing, say, sciatic pain down your back of your leg because the muscle develops a knot. It's not throwing your hips out of balance so that your right hip is higher than your left hip, which will, So we have we have people who walk with a wiggle and people who walk with a waddle. So when a man or a woman is healthy, they will walk with a wiggle, which means their hips go up and down. If a man or a woman is walking with a waddle, they're walking like a pregnant woman. Their hips are going from side to side, and they're not moving up and down. Okay. And when you do that, that causes severe lower back discomfort.
Okay. Now, what about young people? Because we see them when they go to school, toddlers, grade 10, what have you, and they have these huge backpacks that they're carrying around. Are you seeing in young people issues that you have to address?
Definitely. One is weight. You don't have to carry books for 6 different classes if you only have 2 classes that day. You don't have to carry around 50 pounds of weight in your backpack. A lot of the young people don't use both straps in the backpack. They use one over one shoulder. Again, you're going to use a piece of equipment, use it properly. Some really good backpacks come with belts around the waist that actually support the weight at the waist where you're the most strongest.
Oh, interesting. Okay.
But the young people nowadays also have a second problem, which is cell phones and computers. They end up slouching, shoulders forward, head forward all the time. So their posture is terrible.
Interesting.
And that won't affect them when they're young, but when they get to be my age and they're close to 60, yeah, they're going to feel it.
Goodness. So I'm monopolizing you here, but I'm going to ask another question as well. So arthritis, whether it's a rheumatoid or osteo or that sort of stuff, the massage is helping them for the same reasons you were mentioning about getting the oxygen into those areas and making them feel better. Is that something that once you get somebody settled out that you would recommend they come in once a month and get looked at and go through a process? And do you focus on, let's just say I had just my legs that were a problem, would you just focus only on my legs, or would you do a whole body approach?
We would have to look at the individual when they came in to see one, if they're having any inflammation involved with that arthritis as well. I want to clarify one thing right off the bat. Arthritis is a disorder that has no cure. Nothing that they have done can figure out why arthritis is caused. I know heat is a great help to it. I never ached a minute for the 2 years I was overseas. And I came home for a week in Nova Scotia and I was bloody aching already. And the next time it rained, my thumbs let me know it was going to rain. But to answer your question with massage, again, it depends on the level of inflammation in the body. If someone's legs are all puffed up because of the arthritis, then we can't do a whole lot of work on the legs. We have to do very light work on the legs and try and get that excess fluid out of there first. Which is why I said the increase in the blood flow will also take in the good stuff, but it takes out the garbage. And that's what we wanted to do. We wanted to take all that excess fluid and get rid of it. Increasing blood flow throughout the entire body will help the blood go to the connective tissue. That is the problem with arthritis. It might make it feel better. Heat will definitely make it feel better. So sometimes with massage, you'll get, say, a hands in a wax bath, or they'll put hot wax on your elbow and let it wrap it and let it sit there for a little while and let that heat work in. A lot of people carry thermophores in their heating room. So we have thermophore is a medical electric pad that heats up to an extraordinarily high heat. So it's a nice heating pad. You wouldn't want to leave it on your body for very long because it will burn you. But it will heat things up very rapidly so that we can work on them. And by heating things up, we're actually drawing more blood to the area. And by drawing more blood to the area, we're actually drawing more nutrients, more things that make it feel good. When we're looking at massage therapy, look at the whole body. Bone has the highest rate of healing because bone has the most blood supply of anything. Muscles have a very high rate of healing because they have a very good blood supply as well. Tendons, which muscles attach to the bone, so where the muscle ends and it's attached to the bone, that part is called a tendon. So a tendon attaches soft tissue like muscle to a hard tissue like a bone. Tendon has a very low rate of blood supply. So it takes longer to heal a tendon that is torn than it takes to heal a muscle that is torn. And if you have a ligament damage, so if someone sprains their ankle and there's ligament damage, ligaments have the worst blood supply of all. So by increasing blood supply to these areas, you can actually increase healing. But if you've injured something, bone will heal pretty quickly, muscle will heal very quickly, ligament definitely the slowest, and a tendon will heal just below muscle. So it's all related to blood supply. And when you're talking about arthritis, then you're talking usually about bone and ligament. So blood supply is not good for the ligament, but it is good for the bone.
So if someone was to have torn ligament or tendon, would you wait for that to kind of heal up before you went in for massage, or would you go right to it? Because you were mentioning the different levels of tears and how serious they were. Would you?
Yeah. And that would be determined by either the doctor. So the doctor would say, okay, you're healed enough now to go for a massage. And a lot of doctors are referring massage now. If you're healed enough, physiotherapists will sometimes, who will work on you sometimes before we do, because they have, it's within their scope of practice, whereas it's not within ours to work that deep. They can help you along the way, and then they may send you to massage to help the rest of the way. Or in combination. We have a lot of people who do see physiotherapists, chiropractors, and see us at the same time. There's a lot of other therapies out there as well. Traditional Chinese medicine, acupuncture, dry needling, all these things can help. So when it comes to the level you're getting massaged at, it basically is up to you and your person. When you go in to see us, we ask you to fill out a health history. So depending on how you fill out the health history, how you're moving, how your orthopedic tests go, that's where we say, yes, we can work on you, or Today, we're going to go very light pressure here, but we're going to support all the surrounding areas. We're going to massage all the surrounding areas. Because just because you have a muscle that's sore, say in your knee, it's not just your knee that's paying the consequences. Because you're walking funny because you've injured your knee. So therefore, all the legs in your muscle, all the muscles in your legs, excuse me, are taking a hit for this. All the muscles in your buttocks or your hips are taking a hit for this. All your muscles in your lower back are definitely taking a hit for this. So just because your knee is where you've injured it, that doesn't mean everything else isn't sore. You have compensatory muscles around that have to change and hold your body differently than it's used to because of the injury.
Hey, interesting. Just going
Again, we're all connected, head to toe.
less than 6 degrees separation, right? Oh my goodness.
It usually is,
Yeah.
especially in the Maritimes.
So I'm just going to toss this out one last time and see if anyone has any other questions. Shawn, I might get you to stop sharing your screen there.
I will do that right now.
Perfect. And if there's any other questions anyone has, then now would be the time to ask them. But looks like I think we've handled it very well. You've given us lots to think about, Shawn, and I want to say thank you very much for participating in our Building Sustainable Farmers series, and thank you for all the information you've given us. It's been wonderful, and I really appreciate it. If anyone out there is interested in learning more about the Building a Sustainable Farmer or has suggestions on speakers that we could highlight, please send us a message at farmsafety@peifa.ca. And until then, stay safe, stay healthy, and thank you.